sporting injuries are something that are also seen in pain clinics. Now, obviously, pain clinics deal with the pain of arthritis in old age, or injuries that have occurred in the work environment, or persistent pain that's occurred after surgery that's occurred. So a whole bunch of different things, but probably a good 10 to 15% of what we see in a pain clinic is related to injuries that occur in the sporting environment. And that's not necessarily the elite athletes who've got a very dedicated pathway with sports medicine physicians, for example, and very much dedicated physiotherapists to a particular sport, whether it be rugby or swimming or soccer and so forth. But for your average weekend practitioner, weekend warrior, so to speak, a persistent sporting injury may be something that ends up being treated in a pain clinic. So there's a couple of things to consider here. This patient might be a little bit different to the average pain patient. They're still working, they're still holding down a job, they're not taking medication because they haven't found anything works or because they get side effects from medication. And what they're looking for is restarting the sport that they're struggling to do. So their actual focus is maybe not necessarily elimination of the pain, but how do I get back on the track? That's the question that they're wanting to ask. So how do we evaluate that in a pain clinic, for example? Well, we want to understand what's causing the persistent pain. So it's very much looking at the biomechanics of what's involved in that particular sport, what was put at risk or at strain, if you like, and then what type of injury has occurred. And we've got various modalities now of understanding what's happened to the tissues. So there's ultrasound, MRI scan, even plain old x-rays still have a role to play for evaluating the tissues. And out of that process, and with a good clinical examination by somebody appropriately qualified to do so, you can come up with a pretty good estimate of what is causing the pain. And for these particular sporting injuries, we're often talking about injuries to some small joints, or we're talking about tears in some of the supporting ligaments and tendons of a particular joint, ankle joint, knee joint, shoulder joint, elbow, for example. And we can understand what's causing the particular pain and then start to develop a treatment plan around that. One of the things that we use as part of treatment to switch off the pain is what's called platelet-rich plasma injection, PRP. Now, this has been around for probably now over 25 years. It first started being applied to racehorses, obviously the most valuable creatures on the planet. And then from racehorses, it got transferred into being used in elite athletes, professional athletes. And then from professional athletes, it became into recreational sporting activities. And from that, it actually transferred into patients being treated in pain clinics. So there's a long history and a long safe use history of platelet-rich plasma injections into areas that are inflamed or areas that are the cause of persistent pain. So this involves having some blood taken from a peripheral vein, put in a test tube. That test tube is then put in what's called a centrifuge, which is simply a spinning device, so it spins very fast, spins at something like 5,000 revolutions per minute for 3 to 5 minutes. And what that does is it starts to separate the blood out into its individual components. So it comes in layers in the tube. And what we're particularly interested in is not the red blood cells. They get pushed down into a gel layer. What we're not interested in is just pure water, which sits at the very top. We're interested in the middle compartment, and that is consistent of a yellow type fluid that is referred to as plasma. And that plasma has proteins, and we call it plasma-rich protein. Now, with that, that has an interesting number of features. So when that is injected back into a degenerative area or an area that's inflamed or an area that's causing pain, those platelets will disintegrate. And when the platelets disintegrate, they release a whole variety of substances that are aimed towards producing some healing or at least turning off inflammation. And so we can get a very effective reduction in pain, typically for 12 months or so, not necessarily permanently. We don't think it really regrows cartilage. We don't think it regrows tendons. So it's not what we call stem cell therapy as such. But nevertheless, it's very effective as an analgesic in terms of turning off persistent pain. And that can then allow that person to move forward into the next phase, which is undergoing a rehab program. And that rehab program will then be very specific, usually conducted by an exercise physiologist, related to the particular sport they're undergoing. And as part of that, we want to understand the biomechanics of why did they get the pain in the first place. Were they a middle-aged male, somewhat overweight, not doing too good a stretching program beforehand, and suddenly to start to do running up and down hills and getting some inflammation in their Achilles tendon. Kind of know that feeling. So with that, we need to change the biomechanics of what's going on with their footwear, change what they're doing in terms of avoiding hill running, making sure that they've got a very good stretching program and that their calf muscle is not too tight, so what's called gastrocnemius stretching program, and then working their way towards loading up that tendon. We want to strengthen the tendon, so there are particular tendon strengthening techniques that are conducted. That's all done by the exercise physiotherapist who monitors the patient, and we can ease the person back into their program. Now, of course, most people want to just jump straight back in, but if you jump straight back in, you are not doing what an elite athlete would do, which is to work themselves back step by step, knowing that they've had an injury that they need to rehabilitate. So there are no shortcuts. You have to go through the process to get back to where you need to be. And for some patients, they might need the platelet-rich plasma injection every couple of years. For others, they just need a small series of injections and then they don't need it again. It kind of depends on the individual circumstances. But sporting injuries are something that can be treated by sports medicine physicians, obviously, and also can be treated in pain clinics.